On this episode, we'll talk about eating and drinking, we'll talk about heartburn after surgery, and we'll also talk about getting back on track. Hello everyone, I'm Dr. Alvarez from Endobariatric.com, and welcome to episode 61 of the AskDrA show. Delighted to be here with you again at another episode here. And this week we have really good questions, specifically one, getting back on track, which is very important. And but of course the other two questions are really good as well. Of course, you can always submit your questions. You know the drill. Just use the hashtag AskDrA on social media or hit me up on Snapchat. Let's get into the questions.
When do I need to stop drinking fluids before and after meals, during the soft food phase, or when I'm eating regular food?
All right, so when should you stop the drinking before meals? Is it on the soft food phase, or is it on the full, or just when you're eating regular food? It's when you're starting to eat soft foods, all right, because that is important to, you'll notice that if you drink the fluids with your meals, even though it's soft food, it may produce this uncomfortable sensation that we've talked to about this before. So soft food phase, stop the drinking 30 minutes before your meals, your solid meals, and you can resume fluids 30 minutes after. It's soft foods, not the regular foods, all right? So be careful with the eating and drinking at the same time.
How long does the heartburn last after surgery?
All right, so how long does the heartburn last after surgery? Now, this is important to mention that not everybody gets heartburn after surgery. It's normally seen with patients that have had heartburn or GERD, gastroesophageal reflux disease, in the past. So this is commonly seen in these patients, not in new patients or patients who don't have heartburn or don't have that history. Now, let's say you don't have that history of heartburn and you do get some heartburn or indigestion or GERD. How long does it last? Well, just to mention that the heartburn or indigestion, or sometimes the hunger sensation some people feel right after surgery. Some people say, well, I'm hungry after surgery. I thought this surgery was supposed to put the fire out, put the hunger away and put it out, and because you're cutting out that ghrelin hormone, the hormone that produces a hunger. And why am I hungry right after surgery? Well, the deal is that the stomach has just been manipulated. It just had been stapled, oversewn, or just worked on. And this produces a lot of inflammation and swollen tissue on the stomach. That swollen tissue, your brain detects that as hunger. So it doesn't mean that you're really hungry. It's just, it's so swollen that your brain detects that you need food or you're hungry. So that is why in every regular practice you'll be given some antacids or acid blockers to put that fire out. It's very important. I tell patients that is the most important medication you're going home with when you go home, your acid blocker, to take it twice a day, because that helps to put that swollen tissue down and that sensation goes away. Just to let you know that this sensation or this symptom is temporary, and it goes away in the next following days right after surgery. So if you wake up after surgery or a day or two and you feel hungry, remember that the stomach is so swollen. You just had major surgery just a few hours ago, 24, 48 hours, and it's sometimes expected and seen. Now, after surgery, let's say 7 days out from surgery, you shouldn't have the heartburn or indigestion because in theory, you're taking the acid blocker. So if you're not, get yourself back on track, take your medications, and you'll be just fine. But again, we'll talk about this. Not everybody gets it. It's normally seen with people who have heartburn and indigestion in the past history, medical history of heartburn and indigestion, and not patients who don't have it.
I have gone off the good path a little. Now I'm having troubles getting back. Please, any advice?
Bravo. All right. So that's a really good question. How to get back on track. There's certain things you need to do. And if you know that you have falling off the wagon and you're off track, you know exactly in what aspects you're having an issue with. So you need to attack those problems. You need to address those issues that are getting you off track. It's very important. So first, number one is identify these issues, these problems. Is it because you are eating junk food again? Well, if that's the problem, you'll have to stop buying the junk food. When you go to the supermarket, just don't add it to your shopping cart, all right? Because if you don't buy it, there's no way you can't eat it, all right? So it's very important to make wise decisions there. Another issue would be I stopped exercising because I had a good regimen and I stopped exercising. I fell off the wagon. I need to get back on track. So you need to think, what is causing the problem here? Is it lack of time? Is it you being busy or just making up excuses? Because excuses, they're always there. You can always make up something that can move that exercise time of the day apart. All right, so you need to schedule it. I talked a little bit about this on Snapchat this week. You need to schedule it. You need to put it on your. Don't have my phone here with me, but you need to put on your phone, schedule your agenda, and put your exercise time. And it's like you're meeting your local mayor, you're meeting president of your nation or something. You know, if that is a time you scheduled it, there's nothing more important than that time, because it's more important than the president of the United States. It's you. I mean, it's time for you. You need to make that time for yourself. So if you don't make it, nobody else is going to be making that time of the day to exercise. So you need to create that time of the day. So once you create that time of the day, you need to respect it and do it. Now, you starting off slow, that's fine. It doesn't matter as long as you're keeping log and you're inputting the amount of times you've done exercise and how you've been increasing this endurance. It's great. You get motivated. I talked also about on Snapchat. We did a little bit of tips and tricks on Snapchat this week, and we talked about downloading my FitnessPal application. It's a really good app. I really like it. We talked about it before because this app gives you the ability to log in your food and make sure you're doing and having good choices. And if you're not, you log them in and be honest to yourself, because that will give you and open your eyes to what you're really eating and how many calories you're eating and where are the extra calories that you need to be avoiding. So that's number one. Number two, it also gives you the opportunity to log in your exercise. And that's really cool because you know when you did your exercise, how you've been progressing or increasing your endurance or where you stand. So it's quite simple. And there's option number three that's really cool because you can also log in your water. And we've talked about logging in water. If you don't know how much you're doing, you're not keeping track, there's no way, you're lost. So you need to keep track of your water intake. So that application is really complete, it's very good. It's very easy and useful to handle. It's very handy to have on your phone. So those are just a few tips that we can increase and we can put in even more questions down the road of tips and tricks on getting back on track. But number one, schedule your time to exercise, logging your food, make healthy choices, and those are really good tips, take-home message right there. Sounds good? All right, so that's it for episode 61. Question of the day is, did you have heartburn after surgery? Did you? Yes, no? Answers right here on the comment section. I want to hear from you. I'll see you on the next episode.